I'm Ganesh Halade from the University of South Florida at Tampa.
I'm Meena Madhur from Vanderbilt University.
We are here at the AHA BCVS conference in Chicago, and we just finished the very exciting session on cardio-immunology, inflammation, and cardiac pathology. And we are here to cover take-home message for the attendee and for the non-attendee. Couple of points that we learned in the session. In the first talk, we learned from the Slava Epelman, who is from University of Toronto. He talked about the role of cardiac macrophages in hypertension, that how those cardiac macrophages change the phenotype. And for this, he used a very state-of-the-art technology like parabiotics, single-cell sequencing, and then he convinced that this how the macrophages are the heterogeneous, dynamic, and change with the time, but also diversity of macrophages. There are more than one type of macrophages, and they change with the time. And also finally conclude that how the IGF-1 is involved in the signaling. So this is one of the exciting science at the AHA BCVS, and there is continuous growth in this area. So I'll talk about the Xavier Rivello from the University of Minnesota, and he talked about the macrophages, but particularly in the pressure overload model. In this model, the cardiac resident macrophages expand at day 7, and at that time are helping for the angiogenesis, and there is more specific role of the CCL24, and he's expanding more on the CCL24, how that CCL24 is inviting the residential macrophages and helping in the adaptive remodeling. And further, there are more studies to come on the CCL24. So thus overall, this session is great for the role of macrophages, and then I'll pass on to my co-moderator, Meena Madhur.
The third presentation was by Daniela Sihakova, and she presented on how autoimmune T cells can contribute to immune checkpoint inhibitor-associated myocarditis. Immune-related adverse effects are a very important complication of checkpoint inhibitors and associated chemotherapies. And immune checkpoint inhibitor-associated myocarditis is often fatal. So it is very important to understand the mechanisms by which this occurs. And her group used an anti-PD-1 antibody treatment of AJ mice to induce myocarditis. And what she showed is that there are these autoreactive T cells that are targeted towards cardiac myosin. And these cardiac myosin-specific T cells make increased cytokines like interferon gamma, TNF-alpha, and granzyme B. And furthermore, her group showed that cardiac injury, for example, using an ischemia reperfusion model, can actually induce these autoreactive T cells. And so when they combine ischemia reperfusion injury with anti-PD-1 blockade, this increased the incidence of immune checkpoint inhibitor myocarditis from 20% to 40%. And thus, these autoreactive T cells could be very important to target in the future. The final presentation in our session was from Dr. Prabhakar Nagareddy, and he spoke about how cardiac injury can activate neutrophils. And neutrophil count is an independent prognostic factor in acute coronary syndrome, but the mechanisms that sustain a continuous supply of neutrophils after myocardial infarction is unknown. And he showed very elegantly that there was a mechanism by which cardiac injury can increase chemokines, which then activate neutrophils. And importantly, he showed that S100, A8, and A9 is produced by neutrophils, and that this causes further activation of neutrophils. And also these neutrophils go into the bone marrow, where S100, A8, and A9 can activate the endothelium. And this reverse migration of neutrophils requires an activated endothelium. And then there's increased migration of neutrophils from the bone marrow back to the heart in a continuous circle. And he also showed that blockade of CXCR4 and gasdermin, which is important in the inflammasome pathway, can suppress this pathway and our potential targets.
So this is one of the exciting signs at the AHA BCVS, and there is continuous growth in this area.